Hello everyone, this is Bharti Sachdeva Sahni, Associate Professor at Faculty of Nursing, SGT University, Gurugram. In this session, we are going to focus on viral hepatitis B, C and D. So before we begin, let's understand what in general hepatitis is and what are the various causes of hepatitis. So we have got only one liver, we all know this, but why it is important to know that liver has known to perform at least 500 functions, and once it is affected, it is going to definitely take it all on patient's overall health and the quality of life. So before we begin, we'll also discuss about the various functions that liver does, that is detoxification, synthesis of proteins, of clotting factors, bile, cholesterol, metabolism, and many more. So once it is affected, obviously the quality of health is going to be very, very deteriorated. And so what are the causes and how we can prevent it? This is the major focus of the session. So apart from hepatitis or the viral hepatitis, there are many more causes which can affect the liver's health. These are alcohol-related liver diseases. The other ones are non-alcoholic liver diseases, which include especially the fatty liver diseases, the consumption of junk food or the fatty foods. And the others include viral hepatitis, which includes the various types of viruses, which we are going to discuss in this session. And apart from this hepatotrophic viruses, we have also got the coronavirus, because the research has said, the literature suggests that the people got corona infection or the COVID infection also developed liver pathology at some point of time. But this session is going to be exclusively focused on viral hepatitis, and that too empirically, and that too the blood-borne transmission of the viral hepatitis. So the hepatitis stands for the inflammation of the liver or the enlargement of the liver. And the hepatitis which is caused by viruses is known as viral hepatitis. Broadly, the viral hepatitis can be divided into two based upon the route of transmission, and this includes enterically transmitted and blood-borne transmission. Enterically transmitted hepatitis includes hepatitis A and E, and blood-borne transmission of hepatitis includes B, C, and D, which this session is all about. Let's begin with hepatitis B. The causative agent is hepatitis B virus, which is a circular double-stranded DNA virus. And it is important to know here that this is the only virus which has got DNA as its genetic material. The rest all hepatitis viruses are RNA viruses. In Southeast Asia region, 2% prevalence is found to be in general population, which is quite high. Incubation period is known to be 75 days on an average, and they range from 30 to 180 days, that is 1 month to 6 months. And hepatitis B infection is also known to be chronic in nature, that if unresolved, it may progress to chronic disease and may make the patient at high risk for developing cirrhosis and hepatocellular carcinoma. Both of them are irreversible in nature. So it is important to know the transmission of hepatitis B virus. The transmission of hepatitis B can be either vertical, that is from infected mother to baby, or horizontal from one person to another through uses of used syringes, through sexual route, through use of shared items, and through tattoo and blood transfusion, or the patients who undergo hemodialysis. So primarily, two routes are identified here. One is vertical, blood, mother to baby, or other includes either blood-borne or sexually transmitted disease. So to avoid the stigma associated with the disease, it is also important to know that what are the routes or what are the ways through which it does not spread. So hepatitis B virus does not spread through food, that is fecal-oral route or enterically transmitted, unlike the cases of A and E, through sharing of meal, through breastfeeding, through kissing and touching, or through social contact, to say. The high risk of HPV include because primarily the route of transmission is blood-borne transmission and sexual route. So the infants born to infected mother is the main cause. Sex partners of infected persons, men who have sex with men, injection drug users, household contacts of known persons with chronic HPV infection, healthcare personnel who come in contact with hepatitis B infections and their bodily secretions, and hemodialysis patients because of different poking of their veins. Clinical manifestations can be divided into pre-icteric phase, icteric phase, and post-icteric phase. So the infection generally starts with the common general symptoms, that is fever, loss of appetite, tiredness, pain in muscles and joints, nausea, diarrhea, vomiting, pain in abdomen, headache, and it may progress to icteric phase, which includes dark urine, pale stools, and jaundice. So here I want you to recall upon the pathophysiology behind this, that why dark color urine and clay colored stools happen in this case, and how the bilirubin is responsible for developing or producing jaundice in such patients. The diagnoses include, because the liver is the primarily organ which is affected, so liver function tests are the first ones to get deranged. So we can expect here the rise in aminotransferase and bilirubin levels. We can also expect to have a rise in serum ammonia level and a drop in serum albumin level. So serological markers and HPV DNA are also done, which comes under molecular testing. Serological markers we will discuss in detail like this. So hepatitis B virus has got 3 antigens in its envelope. In its whole virion, which includes hepatitis core antigen, which is the innermost particle and which is not released in the blood, and hepatitis B surface antigen, hepatitis B envelope antigen. And similarly, because we know that our body produces specific antibodies to specific antigens, so like there are 3 types of antigens, so the body will produce different antibodies. So these antibodies are named against against the antigen only, against which they are being formed in the body. So anti-HBs, that is hepatitis B surface antibody, antibody to hepatitis B envelope antigen, and hepatitis B core antibodies. Similarly, IgM, that is immunoglobulin M anti-HBC, and immunoglobulin G anti-HBC, which are formed against core antigen, and these are find out to understand between the chronicity or acute phase of the disease. These are all these come under serological markers, and under molecular testing we detect the viral load or the copies of the DNA in the blood. Treatment of HPV. In acute infection, it has been known, the literature suggests that 90% of the cases resolve on their own. So no specific treatment is required, and only supportive or conservative of symptomatic management is given. And in case of chronic infection, oral antiviral agents like tenofovir or entecavir are started. And it is worth mentioning here that the treatment is lifelong, and the follow-up also continues lifelong to screen the patient, to detect the patient if the patient is developing any kind of chronicity or hepatocellular carcinoma or cirrhosis of liver, which are irreversible in nature. So the goal of management is to prevent liver damage and hepatocellular carcinoma. So it is also important to tell the patient that the condition is completely preventable. But if the patient has developed this, obviously the patient has come to you when he has developed hepatitis B infection. So there is no cure available for this, and the patient has to be on lifelong treatment and lifelong follow-up to prevent the irreversible damage to the liver. So this is the treatment guidelines according to WHO, in which various categories are given, or various drug options are given, and the choice of drug will also depend upon the patient's age, prognosis, and the overall health or the presence of comorbidities. So the drugs available or the suggested by WHO are tenofovir disoproxil, fumarate, that is TDF, which is given 300 mg once daily. The second one is entecavir, is given to the patients who have got compensated liver disease and who have not yet started on lamivudine. So they are given 0.5 mg once daily. The third one is if the patient has developed decompensated liver disease. In this, entecavir dose is doubled, that is 1 mg once daily. Or the other one is tenofovir alafenamide fumarate TAF, which is given 25 mg once daily. I hope I am clear with hepatitis B. Let's have a look on with the treatment of hepatitis B. Now we'll discuss about the prevention of HPV. So the HPV is completely preventable, because it's been almost 40 years that HPV vaccination is available in the market, and it is quite widely used. But the sad part is community is not well aware of this. So our role as a health professional is to have immunized ourselves, and to also to spread the awareness among people that they also get the vaccination done. So the vaccination is available for children as well as a part of the national immunization schedule, and it is also available for the adults. So in case they have not got it in their childhood, so they may get it at any time. Same way, because we also learned the route of transmission as that it may get from infected mother to the baby. So the mother in the very first antenatal visit itself is very important to be screened, and if not, um, um, I mean, if she is not vaccinated yet, so she may be vaccinated. And safe sexual practices are important because we got to know about the high risk population, that multiple sex partners or drug abusers or the people who undergo hemodialysis or multiple injection practices. So obviously they are the high risk population and they need to be aware about the use of vaccination. Healthcare professionals obviously being at higher risk of developing hepatitis B because they come in contact with patients. They care for patients with hepatitis B. So the proper use of PPEs and proper vaccination is important for these population as well. Next, coming to hepatitis C. Earlier, it was known as post-transfusion non-A, non-B hepatitis, that is PTNA and B. Later, it was named as hepatitis C. Now, as the name suggests, this is post-transfusion. So primarily the route of transmission is bloodborne only. Unlike hepatitis B, sexual transmission is very unlikely in this case. And fecal-oral route obviously is not the case with hepatitis C. Incubation period has got to be 2 weeks to 6 months, which is quite high. Prevalence again is 1 to 2%. Anti-HCV positivity is high, and people is high in the population who are multiple drug users, who undergo dialysis and who require, for some reason, who require multiple blood transfusion, and healthcare workers. The chronicity is again high with hepatitis C, just like hepatitis B, and it is found to be 80% in this case. It is also because whenever the acute hepatitis progresses to chronic hepatitis, so definitely it increases the risk of cirrhosis of liver and hepatocellular carcinoma. So it is again an important cause of these two conditions. And the 6 genotypes have been identified for hepatitis C, and in India, genotype 3 and genotype 1 are quite common. Transmission of HCV is multiple drug users or blood transfusion or needle stick injuries, blood transfusions, tattoo making. I mean, the cut story short is multiple injections or the use of syringes, needles. This is the main cause by which hepatitis C is transmitted. Infrequent modes of transmission include unsafe sexual contacts, sharing of items which have been used by hepatitis C patient, and mother-to-baby transmission. These are uncommon routes. Clinical manifestations are quite similar with as in case of hepatitis B, that is fatigue, dark orange colored urine or clay colored stool, fever, jaundice, joint pain, body aches or weakness are quite exclusive for the case of hepatitis C. Loss of appetite, nausea, vomiting can be seen in any type of hepatitis, and pain in the right side of the abdomen is also a classical sign of this. Diagnosis, again, broadly, we discussed about liver function test, serological markers, and molecular testing. So same is the case with this hepatitis C, that enzyme-linked immunoassay, which we call as ELISA, can be done, which tests for HCV antibodies. Genotyping can be done, like we said, that we have identified 6 genotypes, and out of which 2 are common in India. So which genotype the patient has got infection with can be tested. Hepatitis C profile serological test, that is antibodies and the activity of the HCV in the blood, can be tested through serological tests. Liver biopsy may be done, but this is not so very common. And liver function tests are the classical tests which needs to be done to check the effect of the virus on the liver health. Treatment includes, the good part here is that it is completely curable, unlike hepatitis B, although this is not preventable. So effective direct acting antivirals has made its 100% cure or remission possible. Genotype-based treatments regimens are also suggested by WHO, and the treatment duration is 12 to 24 weeks, depending upon in which category the patient falls. So the treatment of hepatitis C infection include that it has got mainly 3 classifications. So the first one is patient without cirrhosis, I mean uncomplicated, patient hasn't developed any kind of complication. no signs and symptoms of cirrhosis are present. So in this case, the patient is put on sofosbuvir, which is 400 mg, and declatasivir, that is 60 mg, is given for 12 weeks. So the baseline treatment duration is 12 weeks. In case the patient becomes intolerant to any of these drugs, the duration can be extended to 24 weeks. Let's have a look on this. So the first category, patients without cirrhosis, uncomplicated. I'm repeating this because it is important to know here. Patient is put on sofosbuvir 400 mg and declatasivir 60 mg for 12 weeks is given. In case the patient has developed cirrhosis, has developed some complications, but the body is in compensated stage. Body is able to compensate with that loss. So in this case, sofosbuvir 400 mg and velpatasvir 100 mg is given again for 12 weeks. But in case the patient is acute infection, progress to chronic infection, developed cirrhosis, and now body is in decompensated stage, in that case, ribavirin is also added to the previous guideline category 2, that is sofosbuvir plus velpatasvir plus ribavirin 600 to 1200 mg for 12 weeks. And in case patient cannot be put on ribavirin for some reason, because patient is not able to tolerate this, in that case, only 2 drug regimen, that is sofosbuvir 400 mg and velpatasvir 100 mg, can be extended for 24 weeks. Prevention of HCV, no prevention is, no vaccination is available for this. Only we need to understand about the routes of transmission and how we can prevent it. That is so multiple, because it has been found to be high risk in multiple injection users or unsafe blood transfusion or like tattoo making, etc. Use of needles and sharing of needles basically. So the rule of one is important here. Rule that is 1 syringe or 1 needle for 1 person for 1 time is the entire story short. That how we can prevent it. And for healthcare professionals, complete use of PPE is important while caring for a patient with any kind of hepatitis. Next, the last topic of the session is hepatitis D. This is defective RNA virus. In the beginning of the slide itself, we came to know that only hepatitis B virus is DNA virus and rest of the viruses are RNA viruses. So hepatitis D also a RNA virus, but defective means that it cannot replicate on its own. That is, it requires some carrier, and in this case, hepatitis B virus is the carrier through which it replicates. So it requires HBV replication for its multiplication, and alone it cannot replicate. So if we prevent the patient from hepatitis B, obviously we can prevent the patient from hepatitis D as well. So it occurs as a co-infection or superinfection with HBV. So when we say co-infection, it means HBV and HDV, that is hepatitis B and hepatitis D, occur all together at the same time. And superinfection means patient gets HBV infection first and later on develops HDV infection. So it was also found to be very chronic in nature, and it leads to severe course of liver diseases, that is cirrhosis and hepatocellular carcinoma. Clinical manifestations and route of transmission are same as that of HBV. The diagnosis is also the same: liver function test, serological markers, and molecular testing. But the point is that we need to specifically test for HDV viral load and the antibodies made against HDV. So the antibodies are also called IgM anti-HDV and IgG anti-HDV, and polymerase chain reaction to test the viral load. The treatment is, again, in acute phase, no specific treatment is required, only supportive care is given. And for chronic HDV, high dose interferon alpha with or without tenofovir may be used. Tenofovir, we saw that TAF or TDF, either can be used in this case. Interferons are a kind of immunotherapy or biotherapy, which cytokines are given so that the body can prepare itself to fight the infection. Prevention of HDV. So, because we know the route of transmission of HDV, that it cannot replicate in the absence of hepatitis B virus. So, obviously, the HBV vaccination itself. If the person is protected against HBV, so obviously, he cannot catch HDV as well. So, the proper vaccination against hepatitis B virus is essential. Safe sexual practices are essential, and proper PPE for the healthcare providers, and the other prevention of needle stick injuries or post-exposure prophylaxis is important to know in this case. Coming to the nursing management, in common with all types of hepatitis, and especially the ones B, D, and E, in which the route of transmission is common, that is bloodborne. So the patient education is important, counseling is important. If the patient is hospitalized, so inpatient management and monitoring for the complication, or we can say prevention of complication or delay of onset of complications is must. Excuse me. So the patient education includes that if the patient has been identified to have that infection, so it is important to screen the patients for to screen the patient's family members for infection, because it might be the case that if one person is affected in the family, the other members in the family might also have got infection, or they are at risk of developing infection. So safe sexual practices are important. Vaccination of the family members is important. And the patient needs to be educated that what are the do's and don'ts of the overall health and the caring in this case. Coming on to the next part, that is counseling. The patient might have some toll on the mental health or the psychological problems. So patient might be disturbed to know that suppose hepatitis B, that it is not curable. It can come and go, and it can happen over the periods of time, and it may also lead to, the chances are there that it may get chronic, and it may lead to irreversible damage to the liver, and the quality of life is going to be hampered. So you can suggest the patient, or you can counsel the patient that what are the ways that in which the complications can be delayed or they can be prevented. So the counseling is very important. What are the high risk behaviors that patient have landed up in this condition? Suppose if it is alcohol, or suppose it is drug use, or suppose it is multiple sex partners, or it could be any cause. So we need to identify the cause, that why the patient has got infection, and what are the behaviors that with which it can be culminated. Then if the patient is hospitalized, suppose the patient has got over the acute phase and it has progressed to chronic phase, then inpatient management, continuous monitoring, continuous screening, then identification of the signs and symptoms of the chronic diseases or the irreversible damages to the liver is important to know. And as we discussed under chronicity, that these are the complications which may happen. So these are cirrhosis, liver failure, and hepatocellular carcinoma. So if what the patient develops any of these, so what is going to be the overall management or overall lifestyle modification that the patient can have maximum possible good quality of life in such cases. That's it. I hope you are clear with this. So we'll have a short quiz at the end of this session. I hope you will be able to do